So with everyone being here, I think we can get started. It's 2 o'clock. Good afternoon. I'm Janelle Heinrich, Director of Public Health, Madison, Dane County. Thank you for joining us this afternoon. This week brings a mix of updates regarding the state of the COVID-19 pandemic in Dane County. In the 28 days during which Order Number 11 was in effect, we experienced both downward and upward trajectories regarding the number of people testing positive for COVID-19, as reported in 7-day averages. We reached a low point on December 26th with a 7-day average of 121 and have recently seen an increasing trajectory, reaching numbers similar as to when Order Number 11 went into effect in December. Good news, compared to 1 month ago, the number of individuals hospitalized with COVID in Dane County has continued to decrease, including the number of individuals in the ICU. As of today, 71 people are currently hospitalized, with 24 in the ICU. While it's good to see that fewer friends, neighbors, and loved ones are hospitalized due to COVID than we have seen in months, since October to be specific, the numbers are still high. Additional good news, the COVID vaccine continues to roll out through our community, though it will be quite a while until it is widely available. Last week, it was reported that more than 14,000 doses were administered in Dane County, and we expect those numbers to be much higher when the state provides an update tomorrow. Public Health Madison Dane County staff have provided 2,162 doses to date and have coordinated the connection of over 700 Tier 1A eligible individuals to other vaccine administrators in Dane County so far. Reflecting on these updates, today we are issuing Order Number 12. This order will go into effect January 13th at 12:01 a.m. and be in effect for 28 days. Order Number 12 mirrors much of Order Number 11 and allows indoor gatherings of up to 10 people with physical distancing and face coverings. Outdoor gatherings of up to 50 people are now allowed with physical distancing. Although small gatherings are allowed inside, it is still safest to gather outside. The science continues to demonstrate that gathering outside is safer for health, meaning the risk of transmission is lower than inside. So we have raised this limit in recognition of this evidence. We're encouraged by the declining hospitalizations and more people getting vaccinated every day, but we still have a long way to go. We continue to urge people to mask up, to avoid close contact with others, to stay home if you're sick, and to get tested if you are exposed or have symptoms. There are still many testing available places to get tested in Dane County. Thank you and stay well. I'll now hand it over to County Executive Parisi.
Thank you, Janelle. I appreciate it. And thank you to Janelle and the Public Health Department once again for your work. You know, when you look at what's going on around the state and you look at our numbers, be it our numbers of mortalities, our infection rate, we continue, despite being the second largest county in the state, to be one of the lowest with rates of infection and deaths per capita in the state. And that is because of the orders that have been put forth. And it's because our community has come together and made the sacrifices that so many have made and continue to make to help protect the vulnerable among us, that we have about half of the national average when it comes to rates of infection with COVID. While it's still very high and we still have a ways to go, it's because of your efforts, both the Public Health Department and members of our community, particularly our frontline workers, our business community, our small businesses, and it's appreciated very much. You know, a lot of times in the news we hear about the people who aren't complying, but I think what we don't hear enough about is the people who are complying, which is the vast majority of our neighbors in Dane County. And that's paying off because, as we know, we're in that very strange spot right now where it's never been more hopeful because of the vaccine, but we're still at a very risky place as far as infections go, because while they have come down some from our peak in December, the rate of infection and hospitalization is still high, and the risk for being infected is high. So all of us need to continue to double down over the next couple of months, because the lower we can keep that rate, the quicker that the vaccine rollout will be able to have the impact that we need it to have. And again, the infrastructure that we have in place with our healthcare community, coordinated by public health, has put Dane County at about, last week, we were about 20% of all of the state's vaccinations having occurred right here, despite us having about 10% of the state's population. And I think that's really a positive reflection on our community as we work and move forward. We recognize that the economic hit that so many people have taken and continue to take is taking its toll. And as we work to get the virus under control, we continue to work to get dollars out into the community. Last week, we announced another $4 million in a partnership with Dane Buy Local that will be going out to help some of the hardest hit local businesses. We're currently working with the city to look at the dollars that will become available through the federal and the state government for other purposes, such as work and helping people stay in their homes. We'll continue to work together to help people push through this so that we can protect the most vulnerable among us. Just this week, we vaccinated, we got through the vaccination process at the county's nursing home, Badger Prairie Healthcare. And we have the staff and members and the residents there vaccinated. They've all received their first vaccination now. And I'm always mindful of that population, those who are most vulnerable, the folks who are working the front lines in grocery stores, the folks who are healthcare providers, and those vulnerable adults who are living in nursing homes and in assisted living facilities. It's for them that we focus so hard on working to make the sacrifices that are necessary to keep this virus in check. So again, I want to thank everyone in the community for working so hard to keep this virus under control to the greatest extent possible. Hang in there. We still have a tough couple of months where we have to remain vigilant, but there is hope. There is hope at the end, a light at the end of the tunnel that we're starting to see now because the vaccine is rolling out. But that puts us in this precarious place, right, of having grave challenges and hope at the same time. But we can see the beginning of the end to this, and we all just need to stick together and do what we can to make that happen. So thank you very much, and Janelle, thank you again. I appreciate it.
Thank you, County Executive Parisi. I want to take us back approximately a year ago when a virus that at the time seemed far, far away was starting to catch our attention. We recognized here in Dane County, and particularly thanks to the great work of our public health department, that that virus would likely be coming our way. And public health started to plan and prepare for COVID-19 to hit our community. And indeed, the first case arrived last year, February. It's been an incredibly difficult year for our community since then. And in many ways, we are in the worst of it. The cold makes it less comfortable for us to go outside, and too many folks suffer from isolation, income insecurity, and housing insecurity. But as the county executive said, we can see some light now at the end of that tunnel. Light in the form of federal assistance coming our way and in highly effective vaccines. But we have to keep up our good practices. We have to wear our masks, wash our hands, keep our distance in order to keep ourselves and our community safe and healthy. We're still looking at that post-holiday uptick in cases, and although the numbers are looking better, our hospitals are still very full. In addition, the more easily transmissible variant of the virus that was first identified in the United Kingdom has now traveled overseas and has been confirmed in states across the nation, including this weekend in Minnesota. Specimens were confirmed from 5 residents of 4 Twin City metro area counties. So it's very likely that this new, more transmissible variant of the virus is here in Wisconsin. So we have to keep up all of our protective measures to keep our community safe. I know everyone is excited about the progress of the vaccine, but we need to continue to proceed with caution. While we are working hard to encourage best practices here in Madison and Dane County, our governor and President-elect Biden are working hard to get more vaccine to our state. Governor Evers and 6 other governors wrote a letter recently to the CDC asking that the vaccine that has been promised to our state be immediately delivered. And President-elect Biden is readying a plan to provide 100 million doses in the first 100 days of his administration. And we will be ready when those doses come here to Madison and Dane County. We have accomplished a lot in our county and in our city. We had the first public health orders in our state. We had the first data dashboard in our state. We ran one of the first mass testing facilities, which still continues at the Alliant Energy Center. And now with our partners in healthcare here in Dane County, we're vaccinating the most people in the state. But there is so much more to do before we are through with this pandemic. And we need your help to stay vigilant, to keep following the best practices and the public health orders. Thank you. We'll take questions if folks have them. And I see we have one hand raised. So again, a reminder for the media, if you have a question, please use the hand raise function. And we'll start with Joseph States. You should be unmuted. Go ahead. If you're speaking.
Hi, sorry, can you hear me?
Yeah, there you go.
My apologies. So obviously there's been the slight uptick in cases. So why continue the loosened restrictions from Order 11?
Yeah, we have said and will continue to make our decisions based on the science and around the ever emerging data and evidence related to this virus. And what we know to be true is that the risk of gathering is lower outside than inside. We know that folks continue to gather inside, and we're hopeful that by creating opportunities for gathering outside, that we may create opportunities for less risky places for people to gather. And the science is you know, what we base our decisions on. And so though the numbers are where we were about a month ago, we do believe that gathering outside is safer even in that number of 50.
If there are other questions from the media, please use the raise hand function. If not, then we'll say thank you very much for joining us and have a good rest of your day.